Today I'm going to talk about comparing bulbar conjunctival microvasculature features between Sjogren and non-Sjogren dry eye patients using deep learning-based stabilization algorithm. There is no conflict of interest in this study. First, I'll briefly discuss the conjunctiva, a membrane covering the sclera of the human eye. Its vascular supply originates from the ophthalmic artery's terminal branches for the palpebral conjunctiva and from anterior ciliary arteries for the bulbar conjunctiva, forming anastomosis in the fornices. Conjunctival vessels are mainly superficial, but deeper circulation supplies peripheral corneal arcades, iris, and ciliary body. Inflammation of conjunctiva can make superficial vessels more prominent. Studies found slower blood flow velocity in dry eye syndrome and diabetic retinopathy, and in patients with cardiovascular diseases, indicating conjunctival vessels velocity assessment systemic value. Furthermore, in previous studies, contact lens wear initially increases blood flow rate and velocity, which are parameters associated with microcirculation, and then vessel diameter and density, which are related to morphology. Existing measurements of conjunctival vasculature include functional slit-lamp biomicroscopy, eye flow, and orthogonal polarization spectral imaging have limitations due to motion artifacts by eye movement. In 2021, a deep learning-based conjunctival optical imaging system addressing these limitations was introduced, used in this study for measuring conjunctival microvasculature, measuring parameters such as blood flow rate and velocity, and vessel diameter. In a prospective cross-sectional study conducted at Yeouido St. Mary's Hospital, Seoul, Korea, from April 2020 to October 2021, patients diagnosed with dry eye disease were divided into two groups based on Sjogren syndrome diagnosis through rheumatology tests. Exclusion criteria encompasses a history of ocular diseases, surgeries, traumas, and use of topical eye drops or contact lenses affecting the ocular surfaces. Here are the results. There were no differences between the two groups in terms of gender, age, or other systemic conditions or vascular diseases. And also in ocular surface disease index, tear breakup time, meibomian gland expressibility, lipid layer thickness, and Meibo score. Dry eye symptoms were similar in both groups, reflected in comparable OSDI scores. Furthermore, no significant differences were observed in both average blood flow rate and velocity, which represent microcirculation between the two groups. On the other hand, the conjunctival microvasculature of patients with Sjogren syndrome, dry eye, showed a significant increase in average vessel diameter, indicating morphology compared to non-Sjogren syndrome dry eye patients. The logarithm of blood flow rate correlates positively with vessel diameter, notably in non-Sjogren syndrome dry eye disease, but not distinctly in Sjogren syndrome dry eye. This implies other factors besides blood flow rate may contribute to increased vessel diameter in Sjogren syndrome. The previous finding confirms that, like studies on general dry eye patients, both microcirculation and morphology of conjunctival microvasculature change in Sjogren syndrome dry eye patients. However, notably, morphology change are more pronounced compared to non-Sjogren syndrome dry eye, particularly marked by increased vessel diameter. In conclusion, in Sjogren syndrome, changes in conjunctival microvasculature, especially morphologic change of vessel diameter, may play a key role in causing dry eye disease. I will conclude my presentation and thank you.